The very fact that you were able to see structures never before, diagnose diseases which you could not, see the extent of a disease,
Yes.
be able to characterize, is it cancer, is it not cancer, is it an infection, is it TB, is it something else? That was a game changer. And that's why this changed not only diagnosis, but treatment. We are today able to diagnose early disease so that you're able to treat it early. And diagnosed early, the results are much, much better and also be more specific. Both sensitivity as well as specificity got enhanced, and there's no stopping such a technology.
The year was 1895. A German scientist was exploring cathode rays when he realized rays could go right through an object and form an image on a photoplate. This was the invention of the X-ray, and it forever changed the way doctors would look at disease and treatment. Following this, for the next 100 years, was the introduction of ultrasound, MRI, and CT scans. Again, this changed the modality of medicine and treatment permanently. I am Dr. Archana Nair, and you are watching and listening to The Thoughtful Medic, your space for meaningful conversations with doctors and medical experts. Today, I'm happy to talk about radiology and imaging. Our guest today needs no introduction. He is known as a household name. Mahajan Imaging started in 1991 as one of the early MRI centers in the country. Today, it has expanded to up to 12 centers. It is my great privilege, my absolute honor to welcome Padma Shri Dr. Harsh Mahajan.
Thank you very much, Archana. It's wonderful to be here talking about health.
Absolutely. So, welcome to the podcast, Dr. Mahajan. Let's start at the beginning. Your entrepreneurial spirit is so well known. So, a young doctor came back to India in 1988 from the US. And very soon, it was not just medicine, it was entrepreneurship. So, tell us about that journey.
I think, as happens with most entrepreneurs, mostly entrepreneurs are entrepreneurs, at least during our time, entrepreneurs by accident.
Entrepreneurs by accident.
Yes, it's never by design, as it was in my case. And I actually took on this task, and maybe that's why we succeeded, of going around lecturing in medical conferences, 500 people or 6 people.
So basically convincing people that MRI exists and this is a science and this is a technology which is
To
needed.
show the advantages that were there.
And how did doctors feel? How did they say that,
seeing is believing.
Yes.
And we were showing. So for the first time, you were able to see the brain and the spine and the spinal cord and various organs of the body within the joints, which till that time you could only see on surgery or on autopsy.
So it must have been magical for doctors who had not seen all this to suddenly see the
magical
body.
For me. It was magical for everyone.
So MRI has been so powerful in terms of change.
Absolutely. And we were able to diagnose diseases which it was said don't exist in India.
So for example,
multiple sclerosis.
MS could be seen on MRI.
MS, you could see that. Otherwise, till that time, as juniors, we'd been taught MS hota nahi India mein. Now we know that it's equally prevalent.
But it was
here.
Symptomatically diagnosed then, based on symptoms?
It was thought ki hota hi nahi hai.
Maybe it's not there.
Yeah. And this is not only in India, it's globally.
Yes.
Because MR was so new. And so there were ways of diagnosing CSF, this, that, but, and then for the spinal cord, you were never able to diagnose stuff. It was invasive things and
amazing. So no spinal tap, and yet you can see what's going on inside the spine.
And so it was a game changer.
So why from one center, doctor, 12 centers? So the desire to expand and grow is true entrepreneurship. That's not just one.
No. Like I said, entrepreneur by accident, which you'll hear many entrepreneurs say. But, there is always this desire to do better and better. to reach out to as many people as possible and to get the latest technology. I mean, that's another kida that most of us have. And so we wanted the best. And the best keeps changing, like your cell phone. Every 3 months, there's a new
There's a
model
new one.
coming. Similar was the case with MRI and CT scanners, ultrasounds, that every year, 2 years, there would be something new. And so in that, and there was the CEO of GE Medical Systems, from whom we'd bought the first machine. He, I think, was instrumental in us starting the second one when we were buying this new, the best MRI scanner ever made in the world machine. And he said, Doc, why don't you set it up in a second center? And that set us on this path. And we, from Pusa Road, then we started a center in Green Park.
So the second one was in
The
Green Park.
second one was in Green Park in 1997, which was a 1.5 Tesla MRI scanner and the best that had ever been made with functional MRI technology for the first time.
So what's the difference between MRI and functional
See,
MRI?
functional MRI, it looks at functional aspects of the brain or the body, whereas MRI till then had been only looking at structure.
So it was
So you're looking at metabolic changes in the body, you're looking at functional changes in the body, you're able to, look at changes that happen in the brain. You move your hand, I can show
so
you
that's more
which
dynamic.
it is.
Very
Which part of
dynamic.
the brain lights up. You think, I can tell you, in fact, they say, and this experiment has been done years ago, where they showed that whether you are to reply yes or no to a question using a functional MRI, I can tell you 7 seconds before you actually say yes or no.
Your brain has already lit up in a different way,
Yes,
which the
yes.
MRI can show.
And there were many other aspects, which for cancer, for stroke, diffusion, perfusion weighted imaging. I mean, we won't go into
Yes.
the details of that. It's very technical, but it opened a whole new,
Era.
era of imaging, of function of the body.
And what was the point where you feel, what was the tipping point where you feel that it became so mainstream? Like today, people use these words as, it's as good as common cold and fever to get an imaging done.
I would say that the very fact that you were able to see structures never before, diagnose diseases which you could not, see the extent of a disease,
Yes.
be able to characterize, is it cancer, is it not cancer, is it an infection, is it TB, is it something else? That was a game changer. And that's why I say that, this changed not only diagnosis, but treatment. We are today able to diagnose early disease so that you're able to treat it early. And diagnosed early, the results are much, much better and also be more specific
The
in your
specificity. The
diagnosis. So
specificity.
both sensitivity as well as specificity got enhanced, and there's
Increased.
no stopping such a technology.
There is indeed. So I'll jump a little bit, doctor, because in this day and age, with the advent of AI,
Yes.
and AI's role in radiology is considered so significant today. I want you to talk about AI-led diagnosis and what's the difference between AI and human-led diagnosis.
That's a great question. In fact, AI is not only making a change, bringing about change in healthcare, specifically radiology, but in all facets
All
of life.
facets of life.
Do we ever, go from one place to another without looking at Google Maps? And despite our trying the best, we can't really, beat that. It says 15 minutes. It'll be a few seconds up or down.
Yes.
And driverless cars,
The word is changing. The word
AI
has
is
changed.
percolating
Yes.
into, you ask a question now, it's AI that's answering. Whether right or wrong is a separate matter. So in healthcare, radiology actually was the first branch that got affected because radiology was digital from get-go.
Right.
We've been digital since at least 30 years. And so digital data was already available. And with that, the initial foray into AI happened into radiology.
Much
And
easier because you had all that data format already
absolutely.
there.
And even at Mahajan Imaging and Labs, and I say labs because we were imaging for 29 years, and last 6 years, we forayed into genomics
And that is
lab
fantastic.
pathology, blood tests, all of that. But coming back to the AI question, we got into AI in 2016. And this is when my elder son had come back. He's a physician with an MBA. And so the world of AI was just opening. Deep learning had just been invented, let me say, not discovered.
Almost 10 years ago.
Yes. And that changed the entire scenario. And most of the algorithms that you see today are based on deep learning, though generative AI, which came about 2.5 years ago, and now agentic AI, which has come, are also being
And what is the
used.
difference, if you can describe the difference for the audience?
Deep learning was something where you feed in data and it would itself be able to
Analyze it.
make sense of it.
Okay.
Okay. But you still had to do the annotations and the segmentation and all of that. Uh, Whereas now with the large language models and generative AI, it's a quantum leap where it may even have capability of thinking.
Okay.
And
So
with
in the-
agentic AI, it can actually interact with you as if it's a human being sitting there. But these are still early days
Okay.
of these two technologies, though, ChatGPT and Gemini and all of those are generative AI.
Yes.
And they are making a difference. So it was deep learning which really changed the whole scenario. And Jeffrey Hinton was the scientist who, till 3 years, 2.5 years ago, worked at Google, who discovered it along with the two of his associates. And with that, the entire world of AI opened up. And for chest X-ray, for head CTs, in fact, it would please, I think, most of your audience to know that the first paper on AI to be written in the Lancet, which is one of the finest medical journals in the world,
Absolutely.
came from India, from our group, along with the people whom we collaborated with, Cure.ai. And this was on head CT scans.
That
and
is
to be able to
significant.
pick up critical findings automatically, to be able to generate a report. And this was 2018.
And this was done via AI.
This was showing the capability of AI,
AI.
and
This was
in
published in
diagnosing
Lancet.
disease. And so over the years now, I would say it is still early days of AI in healthcare,
So what do you
in
envision?
radiology.
What do you
I
see
envision that
for
the
radiology
AI,
specifically?
yes, for radiology specifically, I see AI being a radiologist assistant,
Okay.
and we hope it stays an assistant.
That was my next
and
question. Is it
doesn't
going to
become
be just
doesn't become the
assistant?
master, but an AI assistant which increases our accuracy, increases our throughput. We are able to do more report reading
So
in
volume
quicker time,
volume will increase.
and point out mistakes that we make. We are human after all. And ultimately, due to that, be able to, go into democratizing of radiology and healthcare, being able to provide services in far-flung areas where radiologists are not there, to be able to actually make a average radiologist good, a good radiologist excellent,
Excellent.
and an excellent radiologist maybe par excellence, if we can say that, and also ultimately be able to reduce healthcare costs, improve turnaround times of reports. So, this is one thing that AI will certainly do. It is already beginning to do that for chest x rays, for head CTs, head MRIs, fracture detection, lung nodule cancer
And
detection,
apparently,
all
very
that.
early on, lung nodules
Yes,
and things
yes.
like that can be detected.
And in MS, there are 50 lesions in the brain. It's very difficult to count them, to know their sizes. It would take a radiologist 1 hour. But with AI, it's automatic, takes a few seconds. And then for comparing, there were 50, now there are 53, or there are 48.
So the rate
What
of
is new? What is.
yes.
So I see a huge role for this, and also a lot of what is happening globally in radiology AI has come from India. A
So we are
significant
the
part.
pioneers in
We
terms
are
of
amongst the pioneers. We are not the pioneers. Small countries. I mean, I believe the best chest X-ray algorithm has come out of Lithuania, made by a young radiologist who started when he was probably 28 years old. He's now 35. And it is the only AI algorithm which is C marked for autonomous use, meaning that the AI reads the report and sends it out. There's no human intervention.
oh, so that's
A-
completely
and
independent
then
via
we have
AI.
our own homegrown companies. Cure AI is one which is one of the largest deployed AI algorithms in the world. And our own, we used to make algorithms in 16, 17, 18. And then we realized that a lot of AI algorithms are being built. Small developers, startups, large companies, the GE, Siemens, Philips, Googles, IBMs of the world, academic institution, Harvard, Stanford, our own IITs. But we realized so many being built, nothing being used. And at that time, every developer would come with his own box, his own monitor, his own wire, and say, use me. And in radiology alone, I believe 450, 500 algorithms will be used, and more in pathology, more in ophthalmology, cardiology, all branches of medicine are going to use AI,
Yes.
even for treatment decision making. So, in a
That's a
hospital,
deeper question though, the question of decision making and
yes, yes.
personalization.
But I still want the doctor, the specialist, to be at the head of this.
Yeah, that's the
You know,
question. The question is, let us say that AI is helping both quality and quantity. That's
oh,
what I'm hearing. That
absolutely,
the turnover will be more, the
absolutely.
discretion of diagnosis will be
Yeah.
better. But so, what is the role of the radiologist? Will it
So I'll
then?
tell you. I'll
Yes.
tell you. So here is a situation where there are hundreds of AI developers, hundreds of algorithms, each one disparate, and saying, "Here, use me."
So
How
it's not
many?
even standardized.
No, how many wires are going to go into, you got it very well, not even standardized. How many wires are going to go into a hospital information system or a PACS? So that's where, our group
The human
in
factor comes in.
2018, no, said that we have to become the middle layer, taking AI from the bench to the clinic, become the intermediary. So we became something like a Google Play Store for AI in healthcare. And this startup, which actually got incubated in Mahajan Imaging and Labs, is called Carpal.ai. And this today is the only US FDA approved AI platform in the world. I say it very responsibly. It's the only AI platform which is CE marked. It is the only AI platform which has the Australian certification, and the Singapore government uses it for its public hospitals. There's no other.
So you have
And people
standardized
think,
it in a way.
I mean, few youngsters sitting in a small room in Defense Colony actually were the thought leaders to propose this and then to build it. And so this is now Carpool.ai is a well-known startup globally in healthcare AI circles. And today it runs at Harvard, Stanford, Thomas Jefferson, Emory, Yale,
That's very cutting
Cleveland
edge.
University hospitals, and in many large, radiology diagnostic companies. It runs in the largest diagnostic companies of Brazil, Australia, and Singapore. These were the four.
Main ones.
These were the four countries that these youngsters concentrated on,
Yes.
and soon and at the All India Institute in Delhi, and hopefully this will be used by every doctor, every hospital, every diagnostic company, every diagnostic center in the world in the years to come, because it is agnostic of what the AI is. It is the medium to take AI from the bench to the clinic, which used to be their buzzword, the tagline. And they thought of it. And now the world believes that this is the right approach. And so this is,
So
in
that
a
is
way,
true innovation.
what
That is true innovation.
our prime minister talks about, what our government and our leaders and our scientists and the corporate honchos talk about, make in India for the world. So in AI, I think
We are
these
there.
kids
We are there.
have
Amazing.
succeeded in doing that, and
Absolutely.
hopefully, they'll continue to uh, go ahead and
Well,
be successful.
congratulations to you. That's a
Thank you.
very,
Thank
very
you.
powerful snippet that you shared with us. So coming back, doctor, say we talk about 5 to 7 years from now, because like with the internet, like with social media, I think we are going through a period of transition with regards to AI, and people are trying to understand. So coming back to the role of AI with radiology, you do see that AI will work alongside doctors for the best possible model. That's
Absolutely.
and
Absolutely.
it will perfect the model further.
It will.
But you don't see that radiologists will be replaced by
No,
AI in some
no, no.
formats.
I don't think radiologists will ever be replaced. The way we work will change. And for
And how will
certain,
that change?
see, right now, like I said, we do measurements, volumes, this, that
That
be
will be
done
taken over by
automatically.
AI. Yes.
See, radiologist is at the highest level of the cognitive pyramid. Okay. Below that, there are so many tasks which will be taken over by AI. At Mahajan Imaging and Labs about 6 months ago, we, in our MRI scanners, we've put in AI based reconstruction. So that has enhanced the quality of
Of the scanner
the
itself.
imaging.
Ah,
We are able to do much better imaging on the same machine using AI reconstruction. Of course, there's a cost to pay for upgrading, but it was possible to do it. Then our technicians are helped by it automatically. What are the cut lines to be put? How the scanning should happen? All those are being helped by AI. In our CT scanners, now the machine itself using AI automatically, you just say head, it'll go and automatically position, and then, the angles that are to be
so it's
taken
all automated, and the human aspect of it needn't
is
be there.
is
It's
coming
reduced.
down and enhancing the accuracy, the
Precision
quality. And then, of course, at the top of the cognitive pyramid is the
should always
radiologist.
be the
And
human
I
being.
do believe that some of the tasks will be taken away, but that'll only make us give us more time to concentrate on what we do best, which is read the images, helped by AI. And also, not only in radiology, I want to, shift focus even to other fields. A doctor sitting in his OPD,
Yes.
looking at a patient, having 15 minutes to spend,
Yes.
if, you know, AI is able to automatically give the diagnosis, what he has, what are the possible treatment options, then it will spare more time for that doctor to talk to the patient.
But what about the analysis that the doctor is making while they're observing? What about
Of
that
course,
analysis?
it will give him or her more time to talk to the patient, put a hand on the shoulder. Remember, treatment is as much about the trust and the faith that a patient has in the treating
Always,
doctor,
always.
the empathy that comes through, the way the doctor is able to spend time hearing the complaints or the problems that a patient has, than just about, you take this medicine and that's it. So we also hope that with AI, in just trying to understand what the various reports are, what the
So
diagnosis
take
is.
away the technicality, let AI deal with the technicality, let the doctor be the human being, and the more
Absolutely.
humane aspect of it can
Absolutely. And you
happen with
said,
time.
will AI replace radiologists? This question was asked in 2018 also from us at the Radiology Society of North America meeting in Chicago. And what we said at that time, I think holds true even today. Doctors with AI, radiologists with AI will replace doctors and radiologists without AI. So we will have to adopt, we will have to adapt,
Yes.
and the sooner we
We do
realize
that.
that,
Yes.
the better it is.
No, but I like what you're saying, because you're not talking about replacement. You're talking more about conjoining,
Augmentation, you
augmentation of
know,
the two. Yes.
AI, you can say artificial intelligence or you can say augmented intelligence. And
I hope it's the latter.
see, technology can go haywire. It may, today with generative AI, it may hallucinate. It may even, build,
Morph
uh,
into
uh,
something
you
that we
know,
won't understand.
no, it can even hallucinate and say, it may quote a journal. That journal doesn't exist. So, we will have to be on
So
top of it.
errors. So errors are highly possible.
So we need to be on top of it. We need to be the masters and not make AI our master. And that's where I think Jeffrey Hinton, and let me speak a few lines about him. He's the guy who actually developed deep learning. And few years ago, he left Google because he says the pace of advancement of AI, not just in healthcare, but generally in the world as it exists, the pace is too fast, and we need to actually have some control.
Yes.
And that's where, he's now become an activist, saying that, we need to slow the pace or at least control the pace of development of AI. And governments around the world
Agree.
are cognizant.
Yes.
They
Yes.
agree.
They agree.
And I can tell you, in India, the ICMR, the Indian Council of Medical Research, took a lead in this, and nearly 3 years ago brought out a document for the use of AI in healthcare. And so
So there are limitations and there are checks and balances
there
that
have to be
there have
checks,
to be.
checks and
Yes.
balances. We cannot let AI run amok,
Run amok.
and I
Yes.
don't think that'll happen. We need to have a control on it, but we need to not be afraid of it.
Is it a mixed blessing?
See, any new technology is a mixed blessing.
Yes.
But to say that, we don't want it, that's not possible.
And that's not even a reality anymore.
One could never stop the march of technology because
Yes.
it didn't suit me.
Yeah.
And it will develop. We will have to adopt and
Yes.
adapt. And that's the right way of doing it. But lead it and not be led, if that's possible. There is this thought about super intelligence, and that's where, those checks and balances and control
Have to
has to
come
be
in
there.
place. But well said, lead it and not be led. Um, Coming to our view at Thoughtful Medic about medicine as a form of prevention and the role of radiology in prevention. There is obviously the role of radiology in diagnostic health and treating disease early and better. But, Doctor, talk a little bit about how prevention can be at the forefront with imaging.
It's not just imaging, but whole field of diagnostics. And, since school, we've been taught prevention is better than cure. And I think it's more true today than it ever was because we have the tools and the capabilities of being able to prevent, diagnose early, and even predict those who are at higher risk of developing certain diseases, especially serious diseases,
Yes.
non communicable diseases like cancer or heart disease, stroke, renal disease,
So, chronic
liver.
diseases, yes.
So, uh, I may also add prevention is much cheaper than cure. And so, countries of the world like ours, which are in a stage of development
Yes.
and can ill afford the luxury of treatment, I think if we concentrate more on prevention and primary
Even
healthcare,
economically, that's the right
that
answer.
is something we'll be able to afford. And radiology, imaging, genomics, blood tests, all of these play a very, very important role. A role, I think, which has been brought home to us, especially after COVID,
Yes.
where people realized that actually health is wealth.
Is everything.
Economy is tanked
Yes.
because, people
Entire
became sick.
nations
And,
became
and,
sick.
and so I think that's one positive that has come out of all the negatives of COVID.
The
That
realization.
the realization that health is important, knowing your own body is important, and here comes the role of preventive medicine,
Yes.
where just a simple blood pressure check at a young age.
Can actually prevent
Blood
diseases.
sugar. I mean, how much does it cost to test your blood sugar?
Do you think this should be patient driven, or this can be slightly system driven and collaborative?
I think it has to be first about awareness, and then it is society driven. Of course, we as the healthcare providers are there to help in diagnosing, especially serious ailments, in predicting ailments using genomics, in being able to diagnose ailments when they are asymptomatic.
Yeah, so that is the question, doctor. So if we are looking at prevention and an individual is, a healthy individual who wants to protect themselves from future diseases, as a system, like you have a lab and an imaging center, how can we then proactively put prevention at the forefront?
See, it is all age dependent.
Yes.
Children, when they are born, there are certain things you check for
Yes.
so that they don't
Don't
develop
develop into
those
something.
problems, whether it's thyroid or whatever. Then in school, and we are seeing obesity.
Obesity
It's
is a big
it's it's
problem.
becoming a huge thing. Fatty liver. I mean, studies that have been done in Delhi, the numbers are horrendous. I mean, 60%, 62% of Delhiites have fatty liver disease.
60% of Delhiites have fatty liver disease.
This is a study done by the All India Institute.
And this is related to which
This is
aspect of the
related
lifestyle?
to our diet, the
Is
way
it
we
diet
live,
and alcohol?
lifestyle. Alcohol does play a role in it, but there are so many
Lack of
factors.
exercise?
All of it. Bangladesh, Sri Lanka, Nepal, and Pakistan. India, organized healthcare, good quality healthcare is 20-25% cheaper than these countries also.
And how have we managed this in the
This is because, that's how frugal innovation is something which is the
frugal innovation?
buzzword across our country for everything.
Everything.
And it's the same. And then the numbers. And that, actually we are content making marginal profits And that's how things are
So it's
in this
also about
country.
profits. But tell me, doctor, the machines that you're currently using in the imaging centers, these are Indian made, or are they
No, they
produced?
are all, unfortunately, medtech in India, though the government is attempting to change that. Make in India is a big movement now, but most of these are imported. And they are the best in the world. They are the same that are used at Harvard or Stanford or
So,
at
so it's all
King's College London or wherever.
so the same
So the
standard,
same,
but you're
same
able to keep the
machines,
price
same,
point
same quality. So you can imagine how much more money is,
is being
how much more
generated.
profit is being generated there. Also, I would say that their costs are also different
The cost structure is
as
different.
compared to here. And I mean, why do you think even people from the West come to India for treatment and diagnosis? Because it's so much cheaper here.
So do you
And the
see a lot of
quality is high, very high quality.
and the medical? So you see medical tourism for this sector, for your sector. You see a lot of
See, it is more for therapy as yet.
yes, it is.
Diagnostics, it's been more opportunistic. Someone is here in India and they say, let me get a CT angiogram of the heart done,
Yes.
or let me get my ultrasound done or a mammogram done. It's more opportunistic, but there is a big scope for medical tourism, even for diagnostics.
Yes.
And in any case, for hospitals, it's growing exponentially.
And do you see an opportunity for tourism in your space?
Of course, there is.
There is a
It's
lot.
just that we've been so caught up with illness that wellness actually has been brought to the fore after COVID. And now, in fact, at Mahajan Imaging and Labs, we have been talking for the last 5 years about integrated diagnostics. So everything under one roof. No need to go, that's why from imaging, nuclear medicine, we added genomics, we added pathology, blood tests, everything
So one
together.
stop
One stop shop, not only for the patient to get everything done, but also for the doctor
to
to
connect the
be able
dots.
to
Yes.
make sense of all the reports.
Yes.
And this, I feel, is the future.
Yes.
Even before symptoms appear, whether it is through blood tests or it is through MRI of the whole body, that's another thing that's been
So what would
happening.
you suggest, like if a person is listening in and they're saying, okay, I can get a non-invasive screening done, what would you suggest via imaging that people should be doing or proactively
See,
looking
it
at?
is all going to be based on your age,
Yes.
your clinical profile. Do you have some problem or have you been asymptomatic throughout?
So, for example, a woman who's 40 something year old, and we talk of mammograms because that's a very common
Yeah.
topic. And so people don't know, sometimes people don't know what the protocol is. Sometimes people are afraid of the radiations because mammogram is X-ray generated. So there are all these fears. So how do we create awareness
See,
and
the
information?
fear about radiation from mammograms was laid to rest nearly 3 decades ago through a large study that was done in Sweden. And today's mammograms are done at much lower radiation dose,
I think that would be good
especially
for
if
the
you have,
audience to know.
yeah,
Yes.
especially if you have full field digital mammography machines, then it's very, very low. So a lady who's 40 years should start doing mammograms once a year. There was a time till even 6, 7 years ago, we used to say once in 2 years.
2 years, yes.
But then breast cancer is galloping
It's
really in our country,
very
and
common.
especially in the urban areas. The rate of breast cancer is nearly twice in urban areas as compared to rural areas.
And why is that,
in
doctor?
India.
Do
There
you
are
see a reason?
various factors. Late marriage, late childbearing, non-breastfeeding, then
All of these are factors.
sedentary, obesity, smoking, pollution,
Yes.
in everything,
Yes.
not only air, food, water. So these are some of the causes that have been there. And then genetic factors, of course, they will
Play a role
also
as well.
play a role.
So you
And
encourage
so in
annual.
those who are at high risk,
Yes, it's more
The
frequent.
recommendation is starting at 30 years of age. Whereas in those at average risk, it's starting at 40 years of age and doing it annually, once a year. And, at times after X ray mammogram, one may need to do uh, ultrasound
Ultrasound as
for
well.
correlation. Sometimes an MRI mammogram, which is the gold standard test, which is the most sensitive test. So, but at least an X ray mammogram once a year.
So how do we engage people? So let us say, and I've seen this in some cities in the West, that if you are registered with a hospital or with a doctor, the hospital sends you a reminder annually to say you are due for a mammogram, or these are the changes seen. So how do you propose that similarly the medical community can engage with the
See,
community and
it's a double edged sword.
yes,
One, you're doing it for creating awareness and reminding someone that your
you
time
do,
is due.
yes,
Some people take it that, is this a marketing thing now, that, why am I being reminded?
because
There are
again,
there are both kinds,
yeah.
So we do try to remind people, but like I said, we don't want to be pushing it. And
No.
so what I would suggest is, and podcasts like this would be very helpful, uh, is in creating awareness, education, and
And how do
education
we,
not only
yes,
for the masses, for society at large,
at
but
large,
even for physicians,
yes,
for gynecologists, for doctors, so that
they should be sending
they
this
should be.
message that when you
And
come for a
your
checkup,
family physician,
yes.
your GP, is the one who tells you, "Aapka time ho gaya hai."
So how do we inculcate the sensitivity in doctors that hey, let's work on prevention? Like if so, for example, like a Pap smear is more known than a mammogram. I feel people do the Pap smears more often because the gynecologist takes it upon
Absolutely.
themselves.
Now, I think the gynecologists are also actually playing a major role in creating awareness for mammography,
Okay,
because ultimately the lady will go and go to the
you do
gynecologist.
meet your gynecologist,
Yes,
yes,
and so the gynecologists are now much more
empowered to,
proactive
yes.
in suggesting mammography or ultrasound of the abdomen or a echocardiogram or a ECG. I mean, there are so many things that need
And
to be done.
similarly, for like for men, for prostate, when we look at that again, who are the doctors who could intervene and remind men that beyond the age of 40 or 50?
I think again it is there. See, somehow family physicians
Have
have become very, very few. Everyone wants to be a specialist, and that's where we need to revive the GP, the family physician, and because they know everything about you, and they would be ideally suited.
Why has the family physician, why has that role been so mitigated? Because people are searching. And before this podcast, you and I were chatting, and we spoke about my father, who you've known for many years, who was a GP for several years. And you spoke so fondly of the way he practiced and
Oh,
how
yes.
GPs.
See, the GP used to be a part of the family, a member of the family. She or he would know what your problems are, what diseases your mother had, or your father had, or your grandfather had. And they were really advisors about health. Somehow in the last 2, 3 decades, what has happened is, even that's necessary. The emphasis on specialization, super specialization, because that's where the world is headed. And that's right. There are so many diseases which we couldn't address in the past, surgical or medical, which we are now able to treat
Which we are now
because we
treating
have
well.
specialists and super
Yes,
specialists. But in this whole process, actually, the GP or the family physician
has gotten
got
lost.
somewhere lost. And over time, now you have very few young GPs. And,
GPs.
and that's something, a field that needs to be revived, because what happens, and I don't want this is not criticism in any manner, but Today, a specialist is looking at you through a
Certain lens
certain lens.
of that part of the
It's
body.
cube vision
Yes.
of that part of your body. Whereas we need someone to look at you
Holistically.
holistically
Yes.
as yourself, and not as a organ, as a liver or as a heart or as a
So
lung.
may I suggest, like you was talking about the education system and you're talking about doctors, may I suggest that, doctors like you, senior doctors, would you then speak to doctors who are doing their MBBS students and say, hey, we need for the community
Actually,
to have internal
the
medicine
government
doctors?
of India and Niti Aayog specifically, and is cognizant of this, and they are going to be bringing in a new specialist, the family physician. It may take a few months.
So this is separate from MD medicine.
This will be separate from MD medicine. You do your MBBS, and after that, whether it's a 1 year course, 2 year, that conversation is on. You become a family physician, so you are a kind of specialist, but across all the
domains.
major domains that are there. So this is already on the anvil, and I think it's very, very important
That would be
to
amazing.
revive the family physician, who then sees all of you and
Yes.
not just a few organs in you.
That I think would be, very welcoming, I think, to a lot of people. Doctor, before we close the conversation, your thoughts on the doctor-patient relationship today. There is a gap today that patients definitely feel from the doctors, and perhaps doctors feel it too. Your take on what's happening in India with that
See,
respect?
I think as societies across the world have evolved, and also in our country, human beings have changed. Um, Interactions have become more transactional. It is a much more materialistic world that we live
Why
in.
is that?
Why? I'm not a philosopher. I don't think I can answer that question. It's for each individual to answer. And also in this humdrum where everyone is in a hurry, you want to get the job done, no one has time. And so there's somehow this doctor patient relationship from both sides. It's not just the
Which is
doctor
why
who
I
has
asked.
changed,
Yes.
even the patient has changed.
Yes.
The relationship has changed. You remember, I mean, you are very young, you won't remember, but we used to go to our local GP, who would be the colony, he was the doctor uncle. And you go with fever or oh, lal dawai, hari dawai, neeli dawai, and you would trust blindly.
Yes, there was an implicit
And
faith.
you would, and like I said, 70-80% of healing is through that trust. Today, in this era of evidence based medicine, can you imagine you going to a doctor
Local
and
doctor.
he giving you some medicine
Which does not have a prescription
which
on
doesn't
it.
have a label or something like that, and saying ki ye le lo beta, will you take it? I think no.
No.
So this is the era of evidence based medicine. This is the era also where a patient can very easily sue a doctor.
Yes.
It's a fact of life.
Yes.
You get a letter saying, Doc, you did this, but you didn't do this, because of which I suffered. I'm taking you to court. So
So somewhere that faith,
the
faith is lost.
the shoe pinches on both sides.
So one of the things is that a lot of times people, at least historically, put doctors on a pedestal and said they were godlike. And when then they disappointed us by being human, there was a huge disappointment.
No, I think doctors are not gods.
Important to hear that
They
and
are
say
they
that.
are not even demigods. They should not think so themselves. We are doing something that we learnt, something that we practice. We try to do it to the best of our ability. And even patients should not think we are as human as anyone else. When you cut us,
We will
the
also
same
bleed.
blood flows. We have our weak and strong moments. We have our fallacies. We have our own
Personalities
personalities, and just like anyone else. And so don't put us on any
on the
pedestal,
pedestal and then be
because I don't
disappointed.
think we deserve that. We are trying to do a job to the best of our ability, to do it empathetically. And, I, in fact, talk in terms of ABC of being a doctor, which is A stands for availability. I may be the best doctor in the world, but if I'm not available to you when you need me, what good am I to
No
you?
point.
So availability. B is for behavior, the empathy, the ability to listen, the ability to be able to explain, to be able to soothe, calm, to be able to break news which is bad in a manner which is
Humane.
able to calm the nerves to whatever is possible. And C, competence. You have to be competent,
Yes.
but it's said it's in that order. Availability
Abilities
comes
first.
first, your empathy, the human approach comes next, and your competence comes third. So all of those matter, but we are part of society. We are equally good or bad as any other person.
I think it's
and and
important to
and
understand that
and
vulnerability.
but by and large, I'll tell you, at least those of our era, uh, somehow we became doctors because we wanted to become doctors, and also because we did well in class. So
You were the smart ones.
so we were not the shaitan bache, and that somehow stays with you for life.
Yes.
That's how you were.
Yes.
And so we hope that we remain though as we were in school or in college,
Yes.
and that empathy, that feeling, we are able to retain through life. That's all we can hope for, and that we do no harm. I mean, that's the maxim we
Yes.
follow. That
Indeed.
first and foremost, do no harm. And then, within the limits of medical knowledge, we try to do the
The
best that
best.
we can to cure, to heal, and to treat.
And doctor, your message in the spirit of prevention and good health, your message to the listeners about how to be healthy and disease free in this world, with everything that's available to us, actually, we are at an advantage in many ways.
I would say be aware of your body, you know, be aware that you are the master of your body, and that you know, the money accumulated over time will not be useful if you are sick and not able to use it. And, ultimately, prevention, and think of, you know, uh, preserving whatever you have. And if unfortunately you have the genes that put you at more risk
Risk,
of
yes.
certain diseases, which you will know, by looking at family members,
Yes.
your elders,
And
uh,
science is
and through
advanced.
science and
Yes.
testing, then you be more careful. Take control of your health.
So individual responsibility also, along
Absolutely.
along with good
And
habits.
then the tools in this country are there, and as good as the best anywhere in the world. The technology is all there. Some of the best doctors are there, and some of the best hospitals and diagnostic facilities that you could see anywhere in the world are available. But ultimately, uh, I think most educated people know what they are
What to
doing,
do.
right or wrong.
Yes, yes.
And to each one his own.
All right, on that note, on a very, very insightful conversation, thank you, Dr. Mahajan. Thank you very much.
Thank you so much, and have a great life.
Thank you. Hope you like this show. Please do like and subscribe on YouTube, Apple, and Spotify. Please also follow us on Instagram at The Thoughtful Medic Podcast. Also, please share your feedback in the comment section of each of these. It will really help us to create content which is based on your needs. Additionally, do share with your friends if you liked what you saw, and keep tuned in for future episodes of the Thoughtful Medic Podcast.